My name is Harry, and I'm from London.
Meghan Markle here.
Today is December 29, 2024. It is 12:32 a.m. This is video number 2. Video number 1 was I was talking about the background of Luigi Mangione. So we're going to continue with the issues that, the US is facing. Now, like I said in my last video, this was the article that I read, and now we're going to look into this article that talks about the issues. Okay, most Americans blame insurance profits and denial alongside the killer of the United Healthcare CEO death pulls fine. Okay, so we're gonna go over that, and the background of this video almost the same. 4,464 subscribers, new subscribers, welcome. What was the estimate revenue? $93.83. For those who are new, I'm only sharing this because of some issues that I have with YouTube, and it's just for record purposes. Okay, views in the last 48 hours, 1,528 views. Okay, so let's check the article. Most Americans blame insurance profits and denial alongside the killer of the United Healthcare CEO death pool finds. Okay, the link will be in the description. So this was written December 27 of this year. Washington AP. Most Americans believe health insurance profit and coverage denial share responsibility for the killing of the United Healthcare CEO, although not as much as the person who pulled the trigger, according to new poll. And the new survey from NORC at the University of Chicago, about 8, let's click on that. The link will be in the description. Oh, wow. It's a long thing. I don't think I have, I'll leave the, well, I'm not going to put too many links. I'm going to leave the AP link in the description, and then you guys could go into this and click it. All right. And the survey from NORC at the University of Chicago, about 8 and 10 U.S. adults say the person who committed the killing has a great deal or a moderate amount of responsibility for the December 4 shooting of Brian Thompson. This, you know what I'm thinking here? I feel sorry. Well, it depends on how you say it, but December leading up to the holiday, I don't know how many kids did he have, so they probably didn't enjoy the holiday as much. But so does many other families who he keeps on denying for, health insurance that could make them go celebrate the holiday with their families. But anyway, let's move on. That's a different story. Despite that, some have cast Luigi Mangione, the 26-year-old suspect charged with Thompson's murder, heroic figure in the aftermath of his arrest, which gave rise to an outpouring of grievances about insurance companies. One of the things that I raised on my last recording, 26 years old is the age the ACA cut kids into their parents' insurance. Okay, the Affordable Care Act requires plans, insurers that offer dependent child coverage to make the coverage available until a child reaches the age of 26. Both married and unmarried children qualify for this coverage. This rule applies to all plans in the individual market and to all employer plans. Okay, so he was exactly 26 where the age is cut. Okay. Police said the word delay, denied, and depose were scrawled on the ammunition investigators found at the scene, echoing a phrase commonly used to describe insurer tactics to avoid paying claims. Okay, United Healthcare has said Mangione was not a client. About 7 in 10 adults said that denial for health care coverage by insurance. Well, maybe because he couldn't afford to be in it. I'm just saying, because now, I mean, I guess he has. I know his parents are rich. If you look at the other video that I did about his background, his parents are pretty well. They own couple stuff. So maybe now, because of his age, he can be under his family's insurance. But then again, they could give him money to be under his own insurance. But that's a different story. But let's continue. About 7 in 10 adults said that denial for health care coverage by insurance companies or the profits made by health insurance companies also bear at least a moderate amount of responsibility for Thompson's death. Younger Americans are particularly likely to see the murder as the result of a confluence of forces rather than just one person's action. Americans sees a wide range of factors contributing to UHC CEO's killing. The poll find that the story of the slaying is being followed widely. About 7 in 10 say they had heard or read a lot or some about Thompson's death. Multiple factors were seen as responsible. About half in the poll believe that at least a moderate amount of blame is rooted to wealth or income inequality, although they did not think other factors like political division in the U.S. held the same level of responsibility. You know why many of these people don't see that? Is because right now, the kind of the media in the U.S., they don't report news anymore. Okay, things that matters, they don't talk about these things. The UK train the people in the US very well to make people vote against their best interests. They don't even talk about anything that really matters. It's almost entertainment, like Bojo's sister said. Okay, Bojo's sister sent us the warning.
I find it hard to see who is the winner here. I mean, Prince Harry goading the press is only and forcing the press into humiliating payouts is not going to be particularly good for the Sussexes. And it's certainly not great for the press, which is on the hook. I think the total payouts for phone hacking and other illegal information gathering is up to $1 billion, and there are many, many more cases to try. So my point about all this is, I think we only have losers here, and it's in all our interests that we have a strong, vigorous and honest press. And if it was strong, vigorous and honest, I agree that the press would have reported more on the judgment, the Prince Harry judgment that came through on Friday, than it did. It was basically a broadcast story, far more than it was a print story. And of course, the print and broadcast are in competition, so you can sort of understand that. So my question is, who wins out of this? Has Prince Harry done the press lasting damage? Do you think that as a result of the judgment that went against Mirror Group newspapers, we're going to see some sort of state regulation of the press? I genuinely hope not. I don't want the press to be in the last chance saloon at all. I want to see newspapers thrive. This is my industry, and I think it's in all our interests that we have a thrive. And we've got the most wonderful newspapers in the world in this country. You read the newspapers in the States or in France, they're very dull. They're not entertaining at all. I think that we can have both a serious and an entertaining press. And that's what I want to see survive. I don't want to see Prince Harry destroy the industry I love.
And I hope France is paying attention as well. France better pay attention, because these were the two countries that Bojo's sister had highlighted in one of her podcasts.
You read the newspapers in the States or in France, they're very dull. They're not entertaining at all.
Because the US and France, the medias are not entertaining. So they're gonna school the media so you guys will be blind. And what's happening in the Middle East is that they're killing the journalists. Okay? So that's a different point. Patients and doctors often complain about coverage denial and other complications interfering with care, especially for serious illnesses like cancer and or ALS. Insurance industry critics frequently point to company profits and questioning whether the interests of patients are their top focus. United Healthcare made more than $16 billion in profit last year, before interest and taxes, on $281 billion in revenue. So these are the numbers, okay, some of the UK people are looking at and say, how can we get into that market? And that's why they're messing up the NHS. Okay? I spoke about this many times. I haven't followed the political too much in the UK to see how they're dealing with that. But the last time I started, when I was looking into it, these are the things that I saw they were inching to. Okay? Insurers frequently note that most of the revenue they bring, not only that, with what's happening now in the US, it's probably a wake-up call to many of them. And because many of these things that were happening with insurance in the US was going underground, okay, you don't hear too much about it. I will bring it up a couple times in some of my podcasts. We'll highlight and said, the UK, don't become like us. Don't become like us. But now what just happened here, put it forefront. Everybody's talking about it. Maybe now they will take a step back, because what he just did here probably just opened a whole bunch of people's eyes who probably will not pay attention to it. Okay? Insurers frequently note that most of the revenue they bring in goes back out to the door to pay for care. Are they sure about that? United Healthcare said this month that it pays about 90% of medical claims when they are submitted. Maybe now they're changing, but before, and I've heard also is it the headquarters or something? I could be wrong which place, but it has to do with the United Healthcare office. They barricaded because now they're scared. All right. The insurer has not provided details about how many claims that involves. For young people, blame is spread equally between insurers and the killer. Americans under 30 are especially likely to think a mix of factors is to blame for Thompson's death. They said that insurance company denial and profits are about as responsible as Thompson's killer for his death. About 7 in 10 U.S. adults between 18 and 29 say a great deal or a moderate amount of responsibility falls on profits made by health insurance companies, denials for health care coverage by health insurance companies, or the person who committed the killings. Young people are also the least likely age group to say a great deal of responsibility fall on the person who committed the killing. Only about 4 in 10 says that, compared with about 6 in 10 between 30 and 59. Roughly 8 in 10 adults over 60 says the person deserves a great deal of responsibility. The difference between, again, this is not to give Luigi Mangione a pass or anything like that. No. The difference between his action and what the health insurance are doing is that they adjust the law, okay? They hide behind the law to commit the killings, denying people who are on their deathbed when a simple, probably procedures could have solved the problem, but instead they are under the ground. So many of those health insurance are hiding behind the law, which they pay those, how do you call this? Elective officials to put those laws so they could hide behind it. So the blame goes all around. It's the chain of people. We are all to blame for it. We are all to blame for it. The people who are electing those people to not representing the constituent who voted for them, but instead taking money under the table to pass laws for certain group. Okay, this is what I'm saying. We are all to blame. Look at what Trump is going to be the president. Things that he's going to implement. We are all to blame. Well, not 92% of people, but a good portion of the people who voted for him are all to blame for it, because let's say, for instance, what happened with COVID. Obama left a blueprint for him to follow. He decided to ignore it. Millions of Americans die. Now, who should we blame for? Yes, Trump himself for don't care about the well-being of Americans, and the people who voted for him, because so many things were said he was not qualified to be there. And look what just happened. They voted him again. All they had to do is throw the race card, okay? And then all of a sudden, everybody forget about all of their problem. They see the race issue, and then boom, vote for someone who completely disqualified for the presidency after all the thing he has done prior. Okay, so many of these people are gonna be equally to blame. Okay, the chain of event, if you look at the root of things. So what Luigi Mangione did, it went straight to the snake and cut it at the head. Okay, let's continue. About 2/3 of young people place at least a moderate level of blame on wealth or income inequality in general. Okay, many of these people are also to blame as well, because they are voting for people who are not looking after the well-being of all Americans. Okay, this is the foundation of many of these problems. And then the problems start trickling down to other people. When these CEOs are giving money to politicians, it's like an investment for them. They know they could make more money off of doing some unethical things. So they want the law to be placed to shield them from things that they will be doing. Okay? And then you have those politicians, instead of looking out for the benefit of all, but instead, this is what happened. And then even themselves, who's creating the law, are in the process of that as well, in the course here. What makes you think you're going to be healthy all the time? At some point, you're going to get to a point where, you're going to need certain care. And by that time, the people, because the workers not gonna know you from being one of those people who receive money from the CEO to, it's so many things. Okay, let's continue. I want to finish this. Okay, people under 30 are more likely to place blame on the media, for not informing people, with 54% saying that, compared with about 1/3 of older adults. About 3 in 10 struggles with coverage from health insurance in the last year. Frustration with health insurance coverage and the complicated U.S. healthcare system have been simmering for years among patients. About 3 in 10 Americans say they have had a problem getting coverage from their health insurer in the last year, whether those involve problems finding a suitable provider and network, a claim getting denied, or issue getting prior authorization or insurer approval before care happens. These struggles are more prevalent among Americans under 60. United Healthcare says prior authorization help eliminate waste in the system and let people know whether care will be covered before it is delivered. It says less than 2%. I mean, when you're gonna get sick, you don't know this is a certain sickness you're gonna get. Things happen. I don't know. It should be, I don't know. God help us, that's all. It says less than 2% of insurance customers experience a denial of care from prior authorization annually. Now, I'm wondering, if it was another race who did that, will they see this the same way that we are seeing it, the public? Let's say if it was someone other race than this guy who commit that. Will the public will be seeing it the way that they are seeing it now? Because you have President Obama, who was right up there, who was trying to give them health care. Okay? Who was trying to give them health care. But they go against it.
Now, there are some states that have not opted in to this expansion.
That's right.
I've looked in, some of these states include the states that have chosen to not cover to not expand care to our lower income Americans that are most vulnerable include Alabama, is that correct, Mr. Sassi?
That's correct.
Florida?
That's correct.
Kansas?
That's correct.
Mississippi?
That's correct.
Missouri?
Correct.
North Carolina?
Correct.
South Carolina?
Correct.
Oklahoma?
Correct.
South Dakota?
Correct.
Tennessee?
Correct.
Texas?
Correct.
Wisconsin?
Correct.
Wyoming?
Correct.
These are the states that have chosen not to cover the most vulnerable Americans, correct?
That's right.
And these are the states that are also, we're seeing a lot of their representation trying to combat the ACA when they're not even buying into it to protect their own, correct?
We're talking about 2.5 million people who don't have coverage because they have not expanded Medicaid.
Why do you think they are doing that?
Well, I used to work with the governors on this very question, and the truth to that answer is because it was tainted as Obamacare, and it was a completely political decision.
So people are not getting insurance in these states for political reasons. That's your assessment?
Absolutely.
Thank you very much.
Thank you.
I'm just wondering, if it was another race other than Luigi who commit that crime, will the public see it the same way that they are seeing it now? Because again, you had President Obama, an African American, who was trying to give them health care. So then they have to go through all those issues, the denial, whatever, the 3Ds that they were saying. Depose, denial, or whatever. He was trying to give them health care. But the Republican turn it into some nonsense, make them go against it. If another race had committed that crime of that United Healthcare CEO, will the public view it the same way as they are seeing it now? This is a question many Americans need to look into. Because you had Obama again, who was trying to give them health care. Okay, let's continue. Roughly 3 in 10 in the poll say immediate family or close friend have experienced problem getting coverage from their health insurer in the last year. Americans under 30 are among the most likely to say they don't have health insurance.
I mean, I did not have health insurance until I got elected.
Most Americans get health coverage through their job or by purchasing individual policies, and the individual policies was recently. I think it was during the Obamacare. Okay, let me look it up. Let me pause and look for it. Yep, that's what I thought. Okay, the ACA. Because before, if you're not working, you cannot get health insurance. So now, under the ACA, with the Obamacare, okay, allow individuals to get health care. The insurance, that is. On March 23, 2010, President Obama signed the Patient Protection and Affordable Care Act into law. This historic reform required that all individuals have health insurance by 2014. Okay? It was recently. Okay, the Affordable Care Act, ACA, was signed into law by President Obama in March 2010, and it created a health insurance marketplace in every state that allow individuals to purchase private health plans. The ACA was a significant overhaul of the U.S. healthcare system, and it aims to address the high rates of insurance that existed before the law. The ACA also includes an individual mandate that requires most U.S. citizens and legal residents to have health insurance or face a tax penalty. Okay, so it was recently that individual could get it. My goodness, but whatever. All right, most Americans get health coverage through their job. That was the only place before, but then the ACA happened. Then now people could get individual policies. Okay, separate government-funded programs provide coverage for people with low incomes or those who are age 65 and over or have severe illness or disabilities. The poll of 1,001 adults was conducted December 12 through 16, 2024, so it was recently, using a sample drawn from NORC probability-based AmeriSpeak panel, which is designed to be representative of the U.S. population. The margin of sampling error for adults overall is plus or minus 4.2% point. All right, so the link of this will be in the description. It seemed like the root, one of many problems, one of the root of the problem that is happening in the country is racism. Many of these people, you have President Obama, who tried to give them health care. They voted against it. Now they have Trump now, who's going to remove it. And now when they say, when many of these people go to health insurance they don't have, they're saying they don't want Obamacare, but they want ACA. People are looking at them and say, are you that stupid? It is the same thing. All right, so I'm 18 minutes. I'm going to cover some other things into this. One of the things I mentioned in my last video that I want to cover is a tweet. I probably still have it open. Where is it? That someone tweeted and I responded to.
It is a great privilege to be with all of you today.
You know, we ask for forgiveness and please come back.
As you saw me find the love and happiness that I'd hoped for all my life. You are all in this together, and if I may speak personally, we are all in this together, because asking for help was one of the best decisions that I ever made. You will be continually amazed how life changes for the better